to Our Special Lives. Today we're continuing a three-part series for children with feeding tubes on feeding and venting. These videos are going to cover the how-to and some top tips for gravity feeding, syringe feeding, and venting for children with feeding tubes. We're not specifically covering feeding issues for infants less than a year old or children who use feeding pumps, but venting applies to any child with a feeding tube, regardless of how the feedings are administered. And before we get started, if you like these topics and want to hear more, please hit like and subscribe. Okay, so in the first video, we talked about comfort and making sure tube feeding is going well and developing a plan B when the feeding isn't going well. Now we'll get started on the second topic in this series, which is venting. Venting is one of those topics that I think is very underrated in terms of its usefulness. Venting can be an incredible tool, not only to keep your child comfortable during a feeding, but also to understand how your child is processing food and whether their food needs are changing. So what is venting? Venting is a quick procedure where excess air and even some food is allowed to flow out of the stomach by using a syringe. Venting is so important to tube feeding because not only does it release the excess air in the digestive tract, but it can also give you lots of information about how the feeding is going, and even more generally about what your child's feeding and caloric needs may be as they change over time. So first, how does air get in the stomach? There are multiple ways. Some air in the stomach is just a natural consequence of tube feeding or even pump feeding. Some children swallow air. Some children can generate air from the breakdown of a particular food. Some children can have bacterial overgrowth that causes air buildup. Some children can have other structural or motility issues which can cause excess air buildup. And if a child has a Nissen fundoplication or a Nissen, which is where the top part of the stomach is wrapped around the bottom part of the esophagus, usually to prevent reflux, air buildup is much more common because excess air can't be expressed through burping. In our first clip, we're going to go over the basics of how to vent. And you can see here that we're following the basic steps.
Okay, so our first step is that we're going to put the feeding extension into the feeding tube if it's not already inserted. Then we're going to pull up a little bit of water, maybe about 10 or 15 milliliters, into a 35 milliliter syringe. We're going to insert that into the feeding tube extension, undo the clip, push the water through the feeding tube extension, clip it again, then remove the syringe and remove the plunger from the syringe, reinsert the syringe into the feeding tube extension, unclip the feeding extension, and then you'll see here there's a nice flow of stomach contents and food flowing back into the syringe.
Okay, so how often do you vent? For our child, we typically vent prior to a feeding about every 20 to 25% or so throughout the feeding, and then we vent about 10 minutes after the feeding. We also vent periodically between meals or as free water is given. Venting takes about 30 to 60 seconds, so it doesn't take a lot of time. Our son has both a feeding tube and a Nissen, which can trap air more frequently in the stomach. So that's something we take into consideration for our frequency of venting. Once you experiment with venting, and as we'll talk about later, once you make sure that your child is actually in the right position to vent effectively, you can figure out your own venting protocol. Whatever you decide, make sure that it's communicated to everyone who's feeding your child to make sure that your child is consistently comfortable during the feedings. Okay, so once you vent, there's a couple of things to keep in mind. Are you getting a lot of excess air? If so, you may want to examine what the child ate, particularly if they're in a blenderized diet, to see if there could be a food intolerance, particularly if you're introducing new foods. Like, for example, my son doesn't tolerate pears. It created a ton of excess stomach gas. And if the food is not the culprit, you might want to check with your GI to see if there's another issue going on, like a bacterial overgrowth. If your child is constantly building up excess air, like from swallowing air, for example, you may want to talk to your doctor about using something called a Farrell bag, which funnels air out of the stomach continuously. Here are a few additional clips of venting, what it looks like and what it sounds like.
In this clip, you can hear what it sounds like when air escapes from the stomach. In this clip, you can see what it looks like when stomach contents are freely flowing back out of the feeding tube.
Okay, here's one other concept for venting that I think is very, very important and may be overlooked. I'm going to demonstrate on this bottle, and this is as though a child is upright. You can see the food and stomach contents is on the bottom and the air is on the top. I've drawn a little feeding tube, this black dot right here. So you can see the air is at the top, the stomach contents are at the bottom. Is the air near the feeding tube? No. If the child reclines, is the air near the feeding tube? Yes. So my point is that you may be going through the motions of venting when your child is in an upright position, but you may actually not be getting all of this excess air that's in the stomach. And you may find that if you recline the child, the air can reach the feeding tube and be expelled through the venting process. Even if your child tolerates eating while sitting, venting may require a different position. That's my point. Now, what else does venting tell us? Venting can show us how much food is coming back out into the syringe. So if you're in the beginning of a meal and the stomach motility is optimal because the stomach is pretty empty and your child is hungry, you likely won't see a whole lot of food coming back out of the syringe. However, if you're closer to the end of a meal, it would be more expected to see more food coming out of that syringe. But a lot of excess food coming out of the syringe, like more than about an ounce or 35 milliliters, may indicate a few things. One, it could indicate that the feeding is going too fast, and you may need to slow down how long you're taking to feed the meal. The second thing it could indicate is that the feeding volume may be too much, or the amount of calories may be too much, and your child just doesn't need that volume or amount of calories. The third is that if your child is on a blended diet, one of the foods in the feeding may not be tolerated well, or there could be more fat or fiber in the meal than the child can tolerate. I'll give you two specific examples of this. We find with our son that sometimes we need to increase his calories if he's going through a growth spurt. And once he's done with that growth spurt, sometimes we find that he becomes overly full and isn't accepting the same volume or calories as before. So when he starts consistently backing up food into the syringe for several meals in a row, when we vent him during those feedings, we know that it's time for us to pull down the calories and the volume somewhat because he's through with his growth spurt and he doesn't need the same level of calories. Another example is that when we were first experimenting with foods for a blenderized diet, we tried avocado. And when we fed him a blend with avocado, he would back up a lot of food into the syringe when we vented him. We learned that the combination of fat and fiber in this particular food was not a good fit for him, and it slowed down the rate at which his stomach processed food way too much. So on the other hand, if you're bolus feeding, i.e. not using a feeding pump and or doing continuous feeds and getting minimal stomach contents coming out toward the middle or end of a feed, or nothing is coming out, two things could be going on. One, you may want to look at whether your child is getting enough food at a given feed or enough hydration. For example, in the example that I talked about earlier when my son was going through a growth spurt, we were seeing that we just weren't getting any food out when we would vent him, and that he clearly needed more calories. The other thing to watch out for as you get to the end or middle of the feed is when you don't get any air or stomach contents coming out, something could be blocking the feeding tube and preventing air and food from passing. When you get to the midpoint or end of a feed, stomach contents should kind of be flowing nicely in and out of the stomach. But if they're not, you should be suspicious. And this gets to our number one troubleshooting technique for venting. And actually, you can use this trick for venting or feeding, which we'll talk about in another video. We call this the reverse vent because instead of removing the plunger and allowing the stomach contents or air to naturally flow back into the syringe, you're going to leave the syringe plunger in the syringe and actively pull out some of the stomach contents. And you may find that fiber from the food or even mucus in the stomach can be blocking the flow of air or stomach contents from coming back out of the feeding tube. So, if you are going through the motions of venting but nothing is coming out, the child could actually be building up excess air or be getting overly full and uncomfortable and maybe even nauseated, and you may not know it because the flow of stomach contents out of the tube is blocked. If you reverse vent and you pull the gunk back out into the syringe, typically a few mLs, maybe 10 mLs, and discard that, and then try flushing and venting again, you can make sure that you're getting that good flow of air and food back into the syringe. Here is a clip of us doing that.
Okay, here we're pulling back on the syringe and pulling stomach contents out of the stomach. You can see that there's thick, chunky stuff coming out of the stomach. That is mucus, and that's blocking the feeding tube.
So those are the basics on venting. As you can see, venting can be an incredible tool, not only to keep your child comfortable during a feeding, but also to understand how your child is processing food and whether their food needs are changing. I'm going to link to other resources that parents can read for further information on this topic. To anyone who's watching, if you like this video, please hit like and subscribe if you'd like to hear more on these topics. And please leave me a comment or drop me a line at Our Special Lives. I'd love to hear from you. Thanks, everyone.